Hi everyone, Amber Canoy here, Visiting Solutions Functional Medicine, once again with Mandi Snell for Everyday Kentucky. Joint pain. Most people don't really think joint pain, hormone imbalance. So let's talk about this.
Yes, you're exactly right. The most stereotypical symptoms associated with perimenopause and menopause are what? Hot flashes, night sweats, insomnia. But guess what? Joint pain is more common in the research than all three of those put together. Some of the reasons that hot flashes and night sweats get the credit for menopause is because you really can't attribute those to anything else, but joint pain is actually more common and often precedes the symptoms of menopause, the classics as we know them. A typical experience of women who are in perimenopause, which we know starts as early as 10 years before menopause, right. And women around age 45 will often suddenly discover, for no explainable reason, that their shoulder is oddly hurting and that they simply can't get their blazer on with this arm. They have to use an alternative arm to do that, or they may not be able to dress as easily because of shoulder pain or hip pain that otherwise can't be explained. So a typical story that we hear at Solutions is someone like Anne, and she enjoys an active lifestyle and she enjoys being very busy, and she begins to experience some unusual joint pain, and she kind of dismisses it as an overuse issue.
Right.
And often it's not recognized to be a hormonal issue very often, but these symptoms are very common, they're very predictable, and they're often dismissed as an arthritis issue. Many times women end up in physical therapy, they're on non-steroidal anti-inflammatory drugs, which can be disruptive long-term. Right. And to have them acknowledge that this is actually caused by decreased estrogen in the joint and lubrication in the joint, and the cause of the typical frozen shoulder, as it's often been called, these women are just spontaneously have symptoms of painful shoulder and inability to move it as well. Wow. And then it will spontaneously go away in 12 to 18 months. And all of that is because of the predictable irregularity, or let's say the predictable unpredictableness of hormone fluctuation in perimenopause and menopause.
So what are our options?
Well, there are non-hormonal and hormonal options, and so women deserve to have the conversation about hormone replacements and its role in helping joint pain. Many women have significant lifelong relief with dealing with this, and many things are definitely optional. Movement is very important. Activity is very important. Moving your body, even supplementation, because of other decline in nutrients in the body. But women deserve to have this conversation and to know that there are treatments and there is hope.
And they don't need to let the hormone replacement therapy phrase scare them either.
Well, they need to have this conversation because we've all grown up in the last 20 years of our adult life hearing that hormone replacement therapy is risky. It's associated with breast cancer, clots, and disease. That information came from the Women's Health Initiative in 2002 and 3 that caused a media frenzy, and hormone replacement therapy causes a visceral response in the medical community and community at large. But that data has been dismissed 6 years ago, and in spite of that, the North American Menopause Society deems that 75% of women still are not being treated for menopause. So make sure that you have the conversation with your provider with Solutions, and make sure that you know what your real risk is in numbers.